How do you identify a malar rash from lupus? Imagine seeing a butterfly painted across someone's face, with vibrant colors and a distinctive shape. That's often how a malar rash from lupus looks. It's a flat or slightly raised patch of red or pink skin that spreads across both cheeks and the bridge of the nose. The shape resembles a butterfly, with the wings stretching across the cheeks and the body along the nose. One key feature is that it usually does not involve the skin folds beside the nose and mouth, called the nasolabial folds. This helps doctors tell it apart from other facial rashes like rosacea or dermatitis. The rash often appears or gets worse after exposure to sunlight or ultraviolet light. Many people notice their skin becomes more red or inflamed after being outside. It can be itchy or mildly painful but is generally not severe. The color of the rash can vary depending on skin tone. On lighter skin, it appears red or pink, while on darker skin, it may look brown, purple, or even black. Sometimes the rash is smooth, but it can also be scaly or flaky. To identify a lupus malar rash, doctors look for certain features. The butterfly shape covering both cheeks and the nose bridge is a big clue. The rash usually spares the skin around the mouth and the folds beside the nose. Its symmetry across the face is another important sign. Often, people with lupus also experience other symptoms like joint pain, fatigue, or fever, which can support the diagnosis. From a rheumatologist's point of view, the malar rash is one of the main signs used to diagnose systemic lupus erythematosus. They will examine the rash carefully, noting its distribution, texture, and whether it worsens with sun exposure. Blood tests for lupus-specific antibodies like anti-nuclear antibodies or anti-double-stranded DNA antibodies are also helpful. Sometimes, a skin biopsy is performed if the diagnosis is uncertain. Managing a malar rash involves protecting the skin from sunlight by wearing protective clothing and using broad-spectrum sunscreens. Treatment may include topical creams to reduce inflammation and medications to control the underlying lupus. It's important to see a healthcare provider if you notice a butterfly-shaped rash, especially if it's new or worsening. Early diagnosis and proper treatment can help manage symptoms and prevent further skin or organ involvement.